Uh, First of all, I will introduce myself. I am Dr. Rohit Mody. I, I did my MBBS and MD degree from Jamnagar, Gujarat. Uh, then one day, then I became a lecturer in preventive medicine because there was no lecturer in medicine available at that time. Being a MD medicine, and I was the first in the university, so I got easily that job, tutor in preventive medicine, and I came to Bombay. I could have gone to USA, but I said nearest is Bombay, so I came to Bombay. I had no idea that I can become a cardiologist. I came here to become neurologist, honestly. I met a doctor who was from my college. He said, "You are mad? You want to become a neurologist?" There is nothing in neurology at that time. There was no CT scan in 1975, no MRI, nothing. Then he brainwashed me. Then what to do? Then I had another letter for Dr. Santilal Shah, Dr. Aswin Mehta. These are all cardiologists. So I went and met them. So Santilal Shah said, "Oh yes, welcome. You become cardiologist." So he gave me registration for D card, doctorate in cardiology at JJ Hospital. And he gave me a post in Harkishan Das Hospital as a tutor, as a registrar in ICCU. So I joined there. I worked in ICCU. So in Harkishan Das, I was there for some time. I learnt a lot about cardiology. There was Santilal Shah was there, Dr. C.V. Shah, Dr. V.V. Shah, the father of C.V. Shah. He was also coming to that hospital. And that was one of the premier hospital, Harkishan Das Hospital. Recently we visited that hospital. Their ICC was very good. And Santilal Shah was the professor of cardiology at JJ Hospital. And I registered under him for the cardiology. But at that place, I learnt a lot about heart attack and how people treat heart attack patients. And first personal experiences I learned there. That's how my journey started in 1975. And today I'm almost completed 40 years in cardiology. In the span of 40 years, I learned a lot about heart diseases. Are you able to listen properly? Yeah. Uh, First, I will tell you a little story, then you can ask me questions, right? Okay, heart is a pump. Heart is a pump which is in the center of the chest towards the left side. It has 4 chambers, of which the left chamber is the most powerful chamber, which gives the blood to the entire body through big vessel known as aorta. So this is the sinus node, which is the pacemaker of the heart, which generates the impulse, okay? And impulse from the right atrium goes through sinus node to AV node by interatrial tract. From there is a AV node, atrioventricular node is a junction where that impulse comes and it slows down. Okay, from there it goes through the right bundle and the left bundle branch, and there is a Purkinje system. So impulse passes through this and it stimulates the ventricle. This is the right ventricle, left ventricle. And here is the sinus node, here is the AV node, then bundle branches. The impulse then, electrical impulse then stimulate the heart muscle and heart contracts. Okay.
He must score, surely! Oh. Hey, your pants are restricting your movement, right, John?
Simply to keep him in the game, John's heart and lungs are working at their limit. But by doing so, they're placing him in mortal danger. Blood is being forced faster and faster through his diseased coronary arteries. Flowing at 5 times their normal speed, blood cells eddy and swirl around his plaques. Bombarded by red blood cells, one fragile plaque is under unbearable strain.
This is artery in which the blood is flowing, and this is a plaque. Plaque means cholesterol deposits in the artery. Okay, and this is a thin layer. Now this part is now coming out. When you are running, jogging, or excited, your blood pressure goes up. Your blood is flowing faster in the artery. Now this fellow is playing in the game. He is excited and possibly tired, and he already have a disease. This is the vessel, and with there is a fat deposits in the artery, which is known as a plaque. There is a thin layer on that, which when the heart rate increases, the blood pressure goes up. At that time, blood is flowing much, so this layer is coming out.
Its thin membrane is ripped open. Within moments, blood cells start to clot around the rupture. Anywhere else in John's body, this clotting response might save his life. But here, in his narrow artery, the effect is quite the opposite. The clot in John's artery traps more and more passing blood cells. It grows bigger, and the flow of blood to John's heart slows down.
When the rupture occurred, and then blood cells gathered there, where there was injury. Like when there is injury here, bleeding starts. But then nature its own mechanism, blood cells come, plugs those injury, and vessel will stop flowing blood. But this is good when it is outside, the bleeding stop. But when it inside, the same mechanism is used. Blood clots that vessel. Now blood cannot flow further, and the artery, this is the artery which supply blood to the heart muscles, and not the bleeding coming out. So here the same mechanism, but is harmful. The blood clots inside the coronary artery, reduces the blood supply to the heart muscles, and now what you will see what happens next.
Downstream, the heart muscle cells are in peril. Their
Heart
oxygen
muscles
supply is
and blood
dwindling just when they need it most. His starving cells send pain signals to his brain. But John has never experienced pain from his heart before. To him, it feels just like indigestion.
Do you eat all that too fast, John?
Perhaps the old man's better off in gold.
He never had experienced heart attack in the past. So he doesn't know that this may be a heart attack. He just felt it is indigestion.
That this is the start of a heart attack. The growing clot is now blocking 2/3 of his artery. John's indigestion is getting worse. He feels a vice-like pain in his left arm. His brain is confused, overloaded with the escalating pain signals coming from his heart. For the first time in his life, the regular beat of John's heart is under threat. A patch of 4 million muscle cells is running low on oxygen.
John, what's up? What's the matter?
5 minutes after his heart attack began, John's body is struggling to deal with the crisis. His brain has triggered a surge of the hormone adrenaline into his bloodstream. This is one of the most primitive and powerful reactions in the human body. Adrenaline arrives in his heart and soaks into its inner walls. The pacemaker begins to accelerate. John's heart is racing at 140 beats per minute, even faster than when he was running around. But now all its efforts are focused on its own starving muscle.
Call an ambulance.
But adrenaline can do nothing about the growing clot, which fills 90% of his artery. The supply of oxygen to his heart cells is down to a trickle. They are forced to shut down the function which absorbs most of their energy. They stop beating, leaving the rest of his heart to take up the slack. John's weakened heart cannot sustain its beat much longer.
We're just playing a game of football.
How's the pain now, John? Okay.
He loves football, John.
It's now 15 minutes since his heart attack began, and the flow of blood through John's artery is almost totally blocked. The heart muscle cells no longer have the energy to hold themselves in one piece. Their thin membranes are starting to leak.
You're gonna be okay, John. Just hang on in there.
John's injured heart is wearing itself out. Its beat is getting weaker. The effects are beginning to tell on the rest of his body. John is struggling to breathe because his lungs are filling with fluid. As his heart weakens, blood backs up in the vessels coming from his lungs. The extra pressure forces liquid out of his blood into the air sacs of his lungs. If the process doesn't stop, he could drown in his own body fluid.
You must keep this on. Nice, steady breaths now. Well done, mate.
Bringing in a 45-year-old male, possible MI, ETA 3 minutes, over.
Just hold on, John. We're nearly there. They'll sort you out.
The lack of oxygen in John's body is beginning to affect his brain. He's dizzy and disoriented. Time is running out for John. His starved heart muscle cells are beginning to burst and die.
Let's get into as fast as you can, please.
If he's not treated within the next 20 minutes, his heart will be so badly damaged it will never beat normally again.
What's the story? John Palmer, 45-year-old. Collapsed with chest pains playing football. No past history, bit hypertensive. BP 90 over 50, tachycardia 120.
When did your pain start, John?
I don't know. They said about half an hour ago.
Don't worry, John. We'll soon have you sorted out.
Are you his friend?
Yeah.
Do you know if he's got a heart problem? Can you give his details to reception?
Right, let's do it thoroughly, quick as you can, please.
Okay, 1, 2, 3.
John is losing 500 heart cells each second, and unlike most cells in his body, they can never be replaced.
He's had a big anterior MI. We have to thrombolize him. No contraindications, so let's give him some TPA.
By measuring the pattern of electricity in John's heart, the ECG locates the dying patch of muscle. Now his only hope is that his blocked artery can be cleared by a clot-busting drug, tissue plasminogen activator, or TPA. The TPA must reach the clot before so many heart cells die that his heart stops, and he dies too. John's heart muscle has been reconnected just in time.
Susie, hi, customer for you.
Only 500,000 cells have been lost. The survivors are starting to beat once more. His condition has stabilized.
See, when the artery is blocked 70 or 80%, then body needs only 20% of the arteries. Blood can flow when the block is 70%, then enough blood is still reaching the muscles. It's sufficient enough. The body is abundant, like it is so much of grains are produced all over, so much of trees are there. In each tree there are so many leaves are there. So because nature is always believes in abundance. So arteries also 100% open, but even if it becomes 70% blocked and only 30% is blood flowing, it will be sufficient for the heart muscles to it. But when it goes beyond 70%, then that's why your doctors, when they do angiography, and when it is more than 70% block, then only they open the artery. They don't open the artery if it is a 45% block or 50%, because their blood supply to the heart is sufficient when the artery is that much. Some of the patients, even the only one artery is open, still the heart is getting enough blood supply. Other all arteries are blocked, because there are other branches from where the blood is reaching to each and every muscle. Remember, each and every cell need blood. Even if block is 60%, you will not have a chest pain. When it is more than 70%, then you will have a chest pain, number one. Number two, when it is 100%, then it is almost that muscle dies if blood is not restored within 5 to 10 minutes time. And that's why if you are walking regularly, running regularly, jogging daily, so all your muscles are having enough blood supply. So many vessels are opened up. Similarly, heart vessels are also, so many vessels are opened up. The one which is used repeatedly, they open up. So they're known as collateral vessels. That's why we say you have regular walking. So all the vessels open up. So in case of crisis, the vessels are not totally collapsed. They are open. They immediately open up. What is angina? Angina is a chest pain which is because of the blockage of the coronary arteries. The blockage is more than 60 to 70%. So patient will not have angina or chest pain at rest. But when he walks faster, when heart rate goes up, when the blood pressure goes up, at that time heart needs more blood supply but not able to meet with that blood supply. So at that time he gets chest pain. But that pain will be short duration. If it is less than 1 second, recently I had one actor who came, one of the small actor came to me, and he said, I am getting pain here. But that pain duration was always less than a second. Then I said, this is not a heart pain at all. No, sir, but you just get it confirmed. Then I did his echo, stress test, and I proved that it was not a cardiac pain. Or on the left side, and it can radiate to the left arm. Rarely it can go up to the jaw. Or sometime on the right side of the body and the right hand, or can go down up to umbilicus, not below umbilicus. It cannot be pain here. This can be appendix pain. So anybody say, I've got chest pain here. So this is not chest pain. Okay. We get sometimes like patients. Similarly, patient can also have a gas in the chest. Patient can also have a regurgitation of the food. Because when the heart is getting less blood supply, simultaneously there may be adrenaline secretion, heart rate may be more, even acid secretion may be more. Patient can have acidity, reflux, and even can have both together. So any pain in the chest should be treated as a cardiac pain unless proved otherwise. That should be the aim. ECG is my slave. I am not the slave of the ECG. I diagnose this is heart attack based on his symptoms. I said he has a heart attack with a normal ECG. Okay. Because ECG takes time. to show. But patient's pain is the first thing. Patient can have an angina, which is a short duration pain. Heart attack pain is a different pain. Heart attack pain is a pain which you experience for the first time in your life. Okay? It will be severe pain which you have never experienced in the past. It will be in the center of the chest, slowly increasing. There will be associated perspiration, sometimes nausea and vomiting. Sometimes you may feel weakness also. Sometimes you feel giddiness also. Sometimes pain can go in the arm, both sides, like angina. But that pain will be severe pain with perspiration, and as if it is a heaviness in the chest, as if you have an elephant sitting on your chest. That type of heaviness will be there. You can never miss a heart attack pain if it is severe enough. But all heart attack not necessarily have a chest pain. Many people die in sleep because of heart attack. First of all, any chest pain is not heart attack pain. Don't have to get panic. Okay? Patient has a pain which is, as I described, that type of severe chest pain with a perspiration, sometimes vomiting. Pain is coming to the left arm. Patient sometimes become breathless or dizzy, or blood pressure may drop down and it may fall down. So these are the situation which is critical. So first of all, immediately call an ambulance or immediately call for a help. Okay? इसका भी एक है तो वो बाद में बताने का. तो second thing is that if the person had earlier heart disease like angina, or if you have a sorbitrate at home, sorbitrate is a drug which open up the artery to some extent, dilate the vessel, and which brings down the blood pressure. So you give under the tongue. This is the one tablet which normally we tell all patients of heart disease to keep with them, sorbitrate, which 5 milligram tablets are available to be kept below the tongue to be dissolved. If it is angina, it opens the arteries, his pain disappears. We tell them you can take every 5 minutes one sorbitrate, so 3 tablets in 15 minutes can be taken. Okay? So heart attack, normally pain lasts 10 to 15 minutes. So if 15 minutes taken 3 tablets, still he doesn't get relief, that means it is a heart attack. You have to take patient to the hospital. Another tablet is aspirin or Dispirin. Dispirin is a tablet which can be easily dissolved in the water. That we always tell patients to keep at home. One full tablet of Dispirin, now chewable Dispirin available, easily dispersible Dispirin is available, put it in a glass of water and give that tablet. One Dispirin, one sorbitrate, this is what you can do at home. But if person is having low blood pressure like situation, don't give sorbitrate. But these days we don't say, even, see suppose person is having if the pain is not due to heart attack because of a ulcer which is ruptured and bleeding is happening, and you give aspirin, more bleeding happen. So we normally say, unless you are 100% sure, don't give anything. Take him to the nearest hospital. Well, doctor can make out. He will take immediately ECG and find out whether heart attack is there or not. If heart attack is there, then there are chances of dying. If no heart attack, he is not likely to die. Angina will never kill anybody. Less blood supply will never kill any patient. Only high blood pressure will never die unless they develop hemiplegia or hemorrhage. They become unconscious, but they don't die immediately. But if they have a heart attack, this is the only condition where chances of death is there. So suppose he has stopped breathing, then what you have to do, that will show you. Okay, right. So which are other pain which can mimic like this, right? So heart attack pain I have described you. So you should be able to make out heart attack pain. If that is not the heart attack, so which other pain can be there? Can there be acidity? Patient can have that type of pain. But any chest pain occurring for the first time in an elderly person, or now Earlier we used to call it beyond the age of 50, but now we say even beyond the age of 30. Consider is a heart pain unless proved otherwise. Okay. If it is due to esophagitis, so esophagus is a food pipe. If there is ulceration in the esophagus, or acidity or hiatus hernia, means stomach, there is a pain, acidity, gas which comes up, patient can have a chest pain. Okay. So pain can be there because of esophagitis, pain can be there because of gastritis, pain can be there because of hiatus hernia, means some part of the stomach is coming up in the chest, can have a chest pain. Patient of a gallstone, gallbladder, can have a pain coming right in the chest. Okay. Similarly, even the breast pain, many ladies can have during menstruation so much of gorging of the breast and they have a lot of chest pain there. And there may be a costochondritis. There is a costal cartilages and this bone, that junction, there is inflammation, so there can be pain there. But these are the pain, when you press, there is a tenderness. So any muscular pain, bony pain, will be on pressure, you will get a pain. So if person is having a pain on pressure, that is not cardiac pain. Okay. Any pain which is very much localized, only at one finger, that is not a heart pain. Okay. Any pain which comes with the movements of the neck, movements of the hand, it is a cervical spondylitis. That pain is not due to heart pain. If patient says, "Sab, मैं ऊपर करता हूँ तब दर्द होता है," that cannot be a heart pain. Okay. Then when any pain comes, when I take deep breath, I get pain. That is not a cardiac pain. Okay. Then when you just do movements and you get a pain, and then you relax, no pain, is not a heart pain. Any pain which is less than 1 minute, 2 minutes or 5 minutes is not a cardiac pain. So pain can be 100. A muscle pain, bony pain, skin pain, nerve pain, spondylitis pain, esophagus pain, gallbladder pain, pain coming from the pleura. Pleura is a covering of the lungs. If that is inflamed, that can also be pain. There can be pain coming from pericardium, which is the upper layer of the heart. It is inflamed. There can be a pain. But that requires diagnosis. So, which are the serious pain? The pain of heart attack is a serious. Or any pain which lasts more than 5 to 10 minutes and patient is anxious, worrying, breathing problem, started coughing simultaneously, breathless, he cannot lie down properly. These are the cardiac pains. So you must make out, okay, these are the serious pains you cannot treat at home. Immediately call a doctor. Or best thing this day, don't call a doctor, go to the nearest hospital. Because treatment given early in heart attack will save person. If doctor comes, he takes ECG, he doesn't have all equipment, then he will call ambulance, and they take a lot of time. Don't call doctor. That's why for last 20 years or so, I have not gone home visit. Earlier I used to go for home visits. Now I say, no, if it is heart attack, then you are going to die, then come to the hospital. If there is no heart attack, then also come to the hospital. Following lunch, if person gets a pain, it can be still a heart pain. So heart attack pain, angina pain is aggravated after dinner and after lunch. Okay. But that pain will be again not 1 minute. Pain will come, choking like sensation. There will be like many people will have a choking sensation in the throat. Choking.
That is
choking is a sensation.
diagnostic word,
Choking.
proper word.
Heart attack can also have a similar pain.
Okay.
So whenever you are in doubt, consider as a heart pain rather than acidity pain.
Okay.
Let your cardiologist take ECG, make sure diagnosis it is not a heart pain, then it's good. Because acidity will not kill you.